Welcome back to our second half of Friends at 5. I'm Janae Bowens, and this evening I'm sitting down with a very important guest. September is Suicide Prevention Month, and joining us live is Jessica Barnes, Director of the Suicide Prevention Program with the South Carolina Department of Behavioral Health and Developmental Disabilities. Thank you so much for being here today.
Well, thank you for having me.
And we know that yesterday marked 988 Day. Can you start by explaining what that day means and why it's so important?
Yeah, so back in July of 2022, they moved the Suicide Prevention Lifeline to the Suicide and Crisis Lifeline for 988, just moving from 10 digits to 3 digits. And a lot of states across the country have been working on building workforce to have the capacity to answer any calls that are routed to our call centers here in South Carolina or the call center of that respective state. So this is a day to recognize any of those people that may need to call in for help, let them know that that line's there, honor the workforce that's answering the lines. And this year's motto was compassionate help anytime, anywhere.
Oh, I love that. And how does calling 988 connect them with resources locally, not just nationally?
Yeah, well, I think that's the great thing that we have our 2 call centers in South Carolina. One's operated by Charleston Dorchester Mental Health Center, and the other's operated by Mental Health America of Greenville County. And because it's our people here in South Carolina, we know our resources. We know of places you can go for help, centers you can go to, treatment providers, and it just kind of means something if you're talking to somebody and you mention a small town, could be Jefferson, South Carolina, and somebody might say, I know exactly where that is. And you can talk with somebody and just know that they're there and they're here for you.
Yeah, that familiarity is really important.
Yeah.
And so how does this month help keep the conversation going and remind people that support is available?
Yeah, so I think with having Suicide Prevention Month and letting people know, having that conversation about suicide or starting that conversation to ask people if they're okay, it's okay to do. Yeah. And this, by having a month to bring awareness to that, is we're letting people know you can have this conversation, start talking about it with people, check in on those that you care about, and we can help let people know that there's more resources out there for them if they ever need to reach out for help.
And so for families watching at home, what are some of the warning signs they can look out for if someone they love may be struggling?
Yeah, the biggest thing I try to tell people is think about change. You know your sibling, your family member or friend, neighbor, close friend. Yeah. So if they are a very outgoing type of person and then all of a sudden you notice that they're withdrawing, maybe they're not being as social, that's a time you want to check in with them. If somebody is isolating more, if their self-care habits have changed, maybe they're not taking care of themselves like they used to. And also if you know that somebody's going through a big change in their life, that is definitely times that you want to check in with somebody, because that could increase a person's risk if they don't know how to cope with some of those changes. And that can be life stressors, maybe even just moving to a new town and not knowing anybody. If you have a new neighbor in your area, walk over, check in on them. Yeah. Let them know that you're also there and have that neighbor to neighbor help and community.
Absolutely. Neighbors helping neighbors.
Yes.
And thank you so much, Jessica, for being here with us today, and thank you for all the important work you do. Yeah. Now, if you or someone you know is struggling, you can dial 988 anytime to connect with the Suicide and Crisis Lifeline. Now let's head over to Efren Afante for